Hi everyone. I'm going to talk today about drugs and cognition. This is of particular interest to myself as this is where I've done a great deal of research. So today what we'll be talking about, we'll do a quick introduction to psychopharmacology, talk a little bit about drug half-lives, how drugs are handled by the body, talk about then each of these different sort of areas independently, talk first about alcohol, caffeine and nicotine, cannabis, a little bit about benzodiazepines because they have a particular effect on cognition, and again this is an area that I have some expertise. And then finally we'll end up talking about possibility of enhancing cognition, or at least the attempts at doing so through different pharmaceutical techniques. So first, here's a quick introduction to psychopharmacology. There are two important areas for us to consider. How does the body handle a drug, which we refer to as pharmacokinetics, and how does the drug have an effect on the body, which we refer to as pharmacodynamics. So pharmacokinetics, the key considerations here are often the route of administration, enzymatic metabolism, primarily through the cytochrome P450 family of enzymes, and then finally elimination. So why is route of administration such an important topic? Well, it has a lot to do with how a drug is distributed, how quickly, and whether or not a drug undergoes what's called first-pass metabolism. So drugs that are ingested through pills or, say, through marijuana edibles, something of that sort, are absorbed best if they are lipid-soluble, that is, they are dissolvable in fat. Because fat molecules get transported through the gut lining into the bloodstream more easily, and they're less likely to be dissolved or completely eliminated in the GI tract and never absorb. So not every drug can be taken orally. So for example, testosterone supplements always have to be administered either intramuscularly or transdermally because it just simply does not survive the GI tract. Drugs that are inhaled or absorbed via mucosal membrane, so usually we're talking about drugs that are snorted like cocaine, must be water soluble, so that is they have to be dissolvable in water. And so some people actually will crush pills and snort them, which is obviously not recommended, but will do so with pills that aren't even water soluble. So for example, Xanax, this is something people do, and Xanax is entirely lipid soluble. So what drug they do get is usually swallowed from the nasal tract. Most injectable drugs, particularly intravenous drugs, are water soluble. Some drugs that are administered intramuscularly are put in like an oil solution or a glycerin solution so that they'll dissolve more sort of slowly over time. Those injections also tend to be somewhat painful. So that's route of administration. Drugs that are inhaled through the lungs actually tend to have the most rapid effect on the brain because it goes straight into the arteries and straight to the brain. Drugs that are injected have the next fastest effect, then intramuscularly, transdermally, submucosally. The slowest tend to be drugs that are ingested because they have to be digested. So enzyme metabolism is the next important part about pharmacokinetics. Most drugs are metabolized by enzymes produced in the liver. A couple just important notes in this area. There are genetic variations in some important enzymes, such as the cytochrome P2D6 family. Those, for example, there are 4 different known variations, people who have a lot of this, sort of somewhere in the middle, and some who have very low. The people who have very low levels of cytochrome P2D6, for example, cannot convert hydrocodone into hydromorphone, which is actually what is used, which is actually what provides pain relief. So these people get very little pain relief from hydrocodone or oxycodone, whereas people who have a lot of this enzyme convert a lot of it into hydromorphone or oxymorphone, in which case they actually make a lot of it and they oftentimes can get sick. Some foods also, such as grapefruit, inhibit enzymes such as the cytochrome P3A family of enzymes, and as a result, people who eat or drink grapefruit can often, it will alter the pharmacokinetic properties of drugs, so they'll either eliminate them more slowly or not at all, or certainly much more slowly, And it can actually increase the effect of these drugs. So for example, most of the benzodiazepines are eliminated by cytochrome P3A, and as a result, people who eat a lot of grapefruit will oftentimes have longer lasting effects from those drugs. Elimination refers to how long it takes for your body to eliminate a drug. Pretty much all drugs except alcohol have what's called an elimination half-life. This also is known as clearance time. It's basically how long it takes to eliminate half the dose of an absorbed drug. So if you take 10 milligrams, one half-life later you'll have 5 milligrams, one half-life later you'll have 2.5, etc. So this is kind of what this looks like. The goal of treatment is often to achieve steady state levels within a certain range. And it usually takes about 5.5 to 6 half-lives to reach steady state. And what's happening is, as you're eliminating it, you add another dose, and then you eliminate more, and then you add another dose, and so until eventually you get within, this is our, the point at which we would like our drug to be, and so we're sort of always within this range as you're taking a drug. Occasionally, you use what's called a loading dose, which is like a Z-Pack, for those of you who have ever taken that, where you take a higher dose the first day. So rather than starting off, working your way up, you start off at a higher dose and then drop down, and then you're still within that range for the time that you're on that drug. Total clearance time from a single dose is the same regardless of initial dose, and this is again right about 5.5, 6 half-lives. So you can see here, if we have someone who takes a single dose, they'll reach what's called peak plasma concentration, and then their levels will drop steadily until about 6 half-lives later, or 5.5 really. They'll have pretty much eliminated all of the dose. The same is true even if they're given twice as much. They're just simply eliminating it at the same rate. So you can see here I've done the math simply for the first half-life, so right when you absorb as much as you're going to, we'll call that 100. One half-life later, you've got 50, 25, 12.5, 6.25, 3.5, etc., until it's really virtually eliminated. In terms of pharmacodynamics, we're primarily concerned with the psychoactive properties of drugs. So we're usually talking about neurotransmitter systems. That doesn't mean that psychoactive drugs don't have effects elsewhere, but this is, of course, where our primary interest is. Broadly, drugs have two kinds of effects on neurotransmitters. They are either agonists or antagonists. An agonist drug boosts the effects of a neurotransmitter. So, for example, any drugs like Xanax, Ativan, Valium, they're what we call GABA agonists. They increase the effectiveness of the inhibitory neurotransmitter GABA, and as a result, they cause reductions in neural firing, particularly in the hippocampus and other areas of the brain, and as a result, drugs like Xanax and Ativan have negative effects on memory while you're under their influence because of that effect on the neurotransmitter GABA. An antagonist drug reduces the effects of a neurotransmitter. So for example, nicotine is a GABA antagonist. So it actually reduces GABA effectiveness, and as a result, in theory, some people thought that nicotine might be useful as a cognitive enhancer, and a great deal of work has gone into that. Unfortunately, nicotine has such strong side effects, and it is also addictive. There is that problem. But it particularly has some noxious side effects because it doesn't just affect GABA, it also affects acetylcholine, and as a result, people get nauseous and dizzy, and so it's not particularly effective in that area. So we talk about drugs being agonists and antagonists as an important way of understanding their effects on the brain. So we'll start with alcohol. Alcohol has very unusual pharmacokinetic properties, which require just a couple of notes. Particularly, as college students, you tend to, a lot of people tend to consume alcohol, of course. First, alcohol does not have an elimination half-life. It's a linear clearance. Most of us can eliminate about 1 drink per hour, and so unlike with other drugs, the total amount of time to clear alcohol from your system is related to your dosage. So if you have 3 drinks very quickly, it's 3 hours before you've eliminated those 3 drinks. The other thing that's very unusual about alcohol is it undergoes what we call first-pass metabolism. So the gut contains alcohol dehydrogenase, which starts breaking down alcohol immediately. Eating prior to drinking slows the absorption into the bloodstream and allows for more alcohol to be metabolized. That's why eating is such an important part of why you may or may not have stronger or lesser effects on from alcohol. Another important note is women have about half the level of this enzyme, and some ethnic groups also have very low levels and must watch their alcohol consumption. So alcohol metabolism is very individualized. So there's a couple of things, particularly for women, as to why they can, the rule really is about half of what men can drink. Part of that is related to alcohol dehydrogenase. The other is total blood volume. Males, on average, are simply bigger, and as a result tend to have higher blood volume, and so the same amount of alcohol is diluted in more blood. And so this is also one of the reasons why people that are bigger can drink more, because they have different blood volume. And some of this is also related to muscle. People with more muscle actually tend to have more blood flowing to those muscles, and as a result can drink more alcohol. So how does the alcohol affect your brain? Well, alcohol is a GABA agonist. It induces euphoria, relaxation, and sedation. Alcohol intoxication slows your breathing, so that's certainly something to be mindful of, certainly in overdosing. Disruptions in GABA result in diminished memory during intoxication, which is why people can oftentimes have blackouts, in particular if they have combined alcohol with other substances, such as Xanax or any of those other sedative drugs. We also know that stress and alcohol interact to influence the opioid receptors. So people who are under a great deal of stress and drinking alcohol are much more likely to potentially develop alcoholism, because it's these opioid receptors that seem to be involved in developing dependence on alcohol, particularly in the reward pathway. There is evidence that 1 to 2 drinks daily is not harmful and perhaps helpful for a variety of reasons, and in fact binge drinking is really the problem. And that's really where we get into problems, particularly for memory. Now, cognitive effects of alcohol, there are national estimates that suggest about 10% of non-binge drinkers, 20% of occasional binge drinkers, and 54% of frequent binge drinkers reported at least one incident in the past year of blacking out. Frontal lobe inhibition appears to result in poor decision-making and reduced ability to understand future consequences of actions. So what's happening is you get reductions in inhibition, and as I'm sure you know, often make poor decisions under the influence of alcohol. In particular, this can relate to safety and is something we certainly have to be mindful of. We certainly also know that reductions in memory are due to reductions in effects at the hippocampal level. I do want to note there is a phenomenon known as Korsakoff's amnesia. And in Korsakoff's amnesia, what's happening is because of damage to the liver and poor nutrition, alcoholics can develop a thiamine deficiency, and as a result they can end up with brain damage from that. And as a result you can end up with some pretty dense amnesia. I do want to make a quick note on intersections between caffeine and alcohol, and this is particularly for the vodka Red Bull drinkers in the world. Caffeine, first of all, masks some of the effects of alcohol. So as a result, consuming significant amounts of caffeine with alcohol can mask how intoxicated you really are. More significantly, while alcohol metabolizes at steady state, caffeine has a half-life. And so if we, at time 1 here, consume some amount of caffeine and alcohol, the alcohol is going to drop off over time, whereas the caffeine will drop off very rapidly. Oftentimes, this sort of curves are crossed, and the caffeine will drop out very suddenly, and you go from being slightly intoxicated to very intoxicated because the caffeine has disappeared. So it's particularly dangerous to drink things like vodka and Red Bull because it can really mask how intoxicated you really are. Speaking of caffeine, caffeine is the most consumed psychoactive drug in the world. It takes about 2 hours to reach peak plasma concentration when drinking caffeine. Metabolism is highly variable, has a half-life of about 3.5 to 5 hours in young adults, which increases as we get older. Smokers metabolize caffeine much faster, while women on oral contraceptives have almost double the elimination half-life. So it's pretty variable. Infants and children have very, very slow, particularly infants, very slow metabolism. We're talking hundreds of hours. So always have to be cautious, particularly nursing mothers have to be very cautious in having any caffeine because that can directly affect their infant. Caffeine is an adenosine antagonist. Adenosine is an inhibitory neurotransmitter. That's why caffeine is a stimulant, because it reduces an inhibitory neurotransmitter. It starts to get a little confusing. It's like balancing equations where you try to figure out what's positive and what's negative. So we're talking about sort of a double negative. We're inhibiting an inhibitory neurotransmitter. Caffeine improves attention and vigilance performance and also shows significant state-dependent effects in memory. So it does actually improve our cognitive functioning, which I think most of us who are caffeine consumers are not surprised by. Of course, there are also withdrawal effects. Caffeine has very significant withdrawal effects. Some of you may have gotten that haven't had enough caffeine headache. Caffeine also has effects on the brain's vascular system, and as a result, caffeine can actually be used to treat headaches. In fact, Excedrin contains a pretty significant dose of caffeine. One thing I want to note is caffeine has traditionally really only been available, in coffee and in sodas and whatnot, and tea. You can now buy powdered caffeine, and this is really dangerous because you can actually overdose on caffeine. It's difficult, mostly because most beverages don't have enough caffeine for you to overdose on. But with these powders available, it's not. Certainly, a lot of pre-workout supplements have very high doses of caffeine, and when taken in combination with other caffeines can be particularly dangerous. So it's something certainly to be mindful of. Nicotine is our other legal stimulant. Nicotine has effects on both acetylcholine and GABA. In smokers, nicotine can improve concentration and paradoxically alleviates anxiety. GABA is related to anxiety. We certainly know that GABA agonists, such as Xanax, alleviate anxiety. And in non-smokers, nicotine can be anxiogenic. That is, it can cause anxiety. In chronic heavy smokers, GABA regulation is altered in such a way that during nicotine withdrawal, GABA actually sort of takes over, and you see significant reductions in attention and memory performance. In fact, some of my research has been in this area, and we've seen memory performance as reduced by as much as 50% in people who have not smoked in 24 hours. So this is particularly important to understand for people who are trying to quit smoking. One of the biggest problems they report is an inability to focus or pay attention. Now, drugs like Chantix are designed to try to alleviate some of the withdrawal effects, and so it's certainly a number of people have been more successful. The other thing to note about nicotine is there is a specific genotype, one that will not respond to Chantix treatment, and also seems to be much more powerfully addicted to nicotine, and we sort of refer to these as the hardened smokers. And so this is a group we really have to figure out how to get their withdrawal effects down to the point where they're tolerable. There's been little success in using nicotine to improve cognition. The side effects are simply too great. People have thought about using this to treat dementia in older adults, and they just simply, by the time you get enough nicotine into an older adult, they're nauseous and dizzy, and so the side effects are simply too great for that to work. Cannabis is, of course, the most widely used illicit substance in the world, although it's not as illicit as it used to be in the United States, certainly not in the District of Columbia, Colorado, Oregon, Washington State, not Oregon. Other areas that have started legalizing marijuana, the active ingredient in cannabis is tetrahydrocannabinol, which is also known as THC. Its cognitive effects is a bit of an open question. For acute effects, there are clear disruptions in attention and reduced motor coordination. We see some reductions in memory performance. The open question is sort of long-term and developmental consequences of marijuana use. And so we're seeing a lot more of this research being conducted given the widespread nature of marijuana use and its widespread availability. But there are benefits. Cannabis does alleviate pain and also has been shown to reduce anxiety. So there are some questions about long-term costs and benefits that we're certainly will be finding out a lot more of. We're sort of conducting a very large scale clinical trial, and hopefully we'll be able to figure this out sooner than later. Benzodiazepines are another class of drugs. Broadly speaking, these are drugs used to treat anxiety and insomnia primarily. These include things like Xanax or alprazolam, Ativan, which is lorazepam, Valium, which is diazepam, Ambien, Versed, which is midazolam, etc. All benzodiazepines are GABA agonists and cause reductions in memory encoding, the reductions in long-term potentiation. Ambien is actually what we call a benzodiazepine. It's not structurally the same as a benzodiazepine, but it has very similar effects. We've actually used the drug midazolam, which is Versed, to study models of memory. So midazolam is a particularly potent mnemonic reducer, causes fairly strong and very dense amnesia. And it's often used in conscious sedation procedures. So these are procedures in which an individual is sedated but awake. So primarily we're talking about things like teeth extraction, people who have to have an endoscopy or a tube put down their throat. Unpleasant, but you need to be awake for those. And so that's why they give midazolam in order to keep you from remembering it. In our studies, we look at models of memory to try to determine how conscious and unconscious components of memory contribute to things like episodic memory and semantic memory in their initial formation. And so it is a particularly potent way to induce amnesia. Finally, just a quick note on cognitive enhancements. This is sort of one of the holy grails of cognitive psychopharmacology, is to find drugs which enhance cognition. Amphetamines certainly boost concentration, sometimes to the point of creating obsessive compulsive disorder because of such narrow concentration. There is some belief that amphetamines may boost consolidation of memories by increasing release of norepinephrine. Unfortunately, of course, amphetamines are potentially addictive and certainly prone to abuse. Adderall, which is D-amphetamine, and Ritalin, which is methylphenidate, are both taken illicitly to increase concentration and attention. There's a thriving trade of these drugs on most college campuses. Finally, there's a drug called modafinil, which has been shown to improve fluid intelligence and working memory. Modafinil is actually designed to treat narcolepsy, but has been found to be used, they actually call it nerd steroids. There's a lot of question about the ethics of cognitive enhancement and whether or not these things should be available at all, or if not, should they be available for everyone. It's certainly an open question and one which we'll be struggling with for some time. Well, thanks a lot. It's been a great semester, and I'm sorry that I didn't get to do this lecture in person, but I will see you all for Exam 3.